Our eyes work as a camera by taking pictures. The eyes send this information down the optic nerve in the back of our eyes to our brain, and our brain interprets what we're seeing. In this way, the optic nerve in the back of our eye is like the cable line that comes into your home, and your brain is like the television that you see the picture on. In short, glaucoma is high pressure in our eyes, and this can destroy our optic nerve and our vision. The high pressure causes our nerve fibers, or this cable line, to slowly die. Glaucoma is similar to high blood pressure. High blood pressure increases your risk of heart attack and stroke. Similarly, high eye pressure causes glaucoma and blindness. Importantly, this is just an analogy. Your blood pressure does not have a relationship with actual glaucoma. If your optic nerve dies from the strain of pressure, then your eye is unable to send its picture to your brain for you to see it. Similarly, if I went outside your home and cut your cable line, you would no longer get a picture on your television. Now, where does the high pressure in our eyes come from? The eye itself is filled with fluid, just like how a tire is filled with air. A tire needs to remain in a certain pressure range, otherwise the tire can be damaged if the pressure goes too high or too low. The eye is the same way. The eye makes fluid, and then this fluid flows forward to the front of the eye and out of the drain. In this way, the eye continues to keep itself inflated with normal pressures. But in some people, this pressure can increase. We call glaucoma the silent killer of vision, as it doesn't typically cause pain or vision changes that are immediately obvious. Glaucoma tends to take years to decades to cause enough damage to become noticeable. It usually destroys your peripheral vision first before sneaking up on your central vision. This can make it hard to diagnose. We check several tests to monitor whether you are at risk of glaucoma or if your glaucoma is worsening. First, we check your eye pressure to see if it's elevated. Pressure is normally between 12 and 21 millimeters of mercury. We also examine your optic nerve to see if there is damage present or the damage is worsening. Finally, we also check a visual field test to identify any areas of vision loss. At your visit, I will review these tests with you. You are born with roughly 1 million nerve fibers in your optic nerve, but if you live at high eye pressure, then over time, these nerve fibers die. These nerve fibers are brain tissue. Due to this, we cannot regrow them. Once they're gone, and they're gone for good. Modern medicine cannot fix the vision once it's gone. We can only protect it from getting worse. With time, glaucoma does steadily worsen. This is why we monitor you regularly. All treatments for glaucoma work by causing your eye to either 1, make less fluid, or 2, to pump more fluid out of the eye. To control eye pressure, we often start with eye drops. These are drops, they're used 1 to 3 times per day indefinitely, similar to how you would be on a blood pressure medicine. These drops have been used for decades and are very safe. Due to them being placed directly on the eye, it is extremely uncommon for patients to have systemic reactions to these drops, as the effects are localized to the eye. Some people respond to and tolerate some drops better than others, but on average, the drops usually decrease your pressure by about 25%. Sometimes it takes trying several medicines before we find the one that works best for you. Some patients need to be on multiple drops. Even after glaucoma surgery, patients with severe glaucoma may still need to be on glaucoma drops. If you would like to avoid drops, then many patients opt to start with a laser called SLT, selective laser trabeculoplasty. This procedure takes about 5 minutes. I numb your eye, and you sit in a device similar to how we examine you in the office. I bring a lens close to your eye and use gentle laser energy to help unclog your drain. It is painless. You will be mildly blurry in the operative eye, but you can drive yourself in and drive yourself home if you are comfortable. We only do one eye at a time. The laser usually works in 80% of people and reduces your pressure by about 25%. It can last for years before wearing off. We can repeat this laser up to 3 times, but after that, it's worth looking into an alternative treatment. If the glaucoma is more severe, then we may need more aggressive surgery to control the pressure. All of the following procedures I'll be discussing are done in the operating room. You will need clearance by your primary care doctor for these surgeries. You will have an IV placed. You are not allowed to eat anything the morning of surgery. The risks of the following surgeries are very similar to cataract surgery. It is a very low risk of infection, and that's the most concerning complication. But we do put you on antibiotic drops to minimize that risk. First, we have a stronger laser that we use in the operating room. It's called the micropulse laser. This laser energy is targeted at the ciliary body. It's the part of the eye that actually produces the aqueous fluid. This laser lowers eye pressure by causing the eye to make less fluid. The laser works well in most people, is less invasive, and can be repeated if necessary. As glaucoma worsens, we can consider physically unclogging the drain in your eye. This is called a goniotomy. This is a surgical incision I place to open the drain of your eye. Importantly, the fluid from your drain flows into the blood vessels and back into your vascular system. Surgically opening your drain will not cause this fluid to escape to the surface of your eye or cause tearing. We often can do a goniotomy at the same time as cataract surgery. Sometimes patients' drains have become too damaged and they cannot be repaired by just opening them up. In these scenarios, we may need to build a new drain. I can place a small tube to help fluid drain out and away from the eye. This fluid also flows back into your blood system and not onto the surface of your eye. The drain is so small you will not be able to see it or feel it. This is a more aggressive and involved surgery with higher risks of complications, but also works the best to lower your pressures. The major problem is that glaucoma does tend to worsen as we get older. Even if we unclog your drain or build a new drain, the body will try to scar that opening down. Closing the outflow will cause your pressure to rise again, and higher pressures can result in more nerve damage and more loss of vision. For some patients, a new drain may work great for 10 years. For another patient, their drain may scar closed in less than a year. This is the unpredictable nature of glaucoma and surgery itself. Building a new drain for your eye is much more invasive and risky than starting you on an eye drop. So we want to reserve those more aggressive treatments for severe glaucoma and save them in case you need them in the future. In other patients, the new drain can work too well and their pressures can become too low and the vision can become blurry. This tends to improve with time as well. After any glaucoma procedure, it is normal for the pressure to fluctuate. It can go up and down like a roller coaster. Usually by 2 to 3 months after surgery, your pressure will have stabilized and will be lower than it was before the surgery. If it's a little higher immediately after the surgery, that's not a problem, that's normal. Glaucoma surgery is not going to improve your vision or correct the vision you have lost. These surgeries are to lower your pressure and protect you from losing any more vision. There is no cure for glaucoma. With time, glaucoma does tend to worsen and become resistant to treatment, and pressures tend to increase. Our goal is to use these therapies to keep your pressure in a safe range throughout your life. Glaucoma nerve damage and vision loss is permanent. We do not have a way to reverse the vision loss it has caused. My job is to protect you from losing any more nerve fibers. Let's work together to protect your vision.